This is Mehul Mankad, and today I'm joined by Ernestine Briggs-King. Thank you so much for joining us.
Thank you.
Ernestine, tell us a little bit about yourself.
I am a clinical psychologist by training, but I wear many hats. I'm the director of research at the Center for Child and Family Health, the director of data and evaluation for the National Center for Child Traumatic Stress, and I'm on the faculty at Duke in the Department of Psychiatry and Behavioral Sciences.
Wonderful. So today we're going to be talking about anger and de-escalation of anger with specific attention to children and adolescents. Tell us a little bit about the impact of anger on families.
Throughout this series, you've discussed the different ways symptoms of PTSD, anxiety, depression, and grief may manifest themselves. Sometimes these symptoms may manifest in the form of irritability, impulsivity, anger, outbursts.
Yeah, it's a mouthful.
And in some cases, rage.
Right.
When emotions run high, the individual is likely to have difficulties in different areas of functioning, at home, at work, or in the community. Family members may be confused by, in some cases, frightened by this irritability, impulsivity, and anger. Just think about a veteran who is upset about his claim being denied.
Right.
He or she may leave a VSO agitated and then go home.
Right.
And just imagine what that might be like for his parents or her parents, a spouse or partner or children. We know that when emotions run high, the likelihood of arguments, conflict, violence, and even abuse is possible. I can see everyone walking on eggshells around this very angry vet, and some of those de-escalation techniques that you described would probably come in pretty handy. But what if the vet is always on edge? I could see folks in the home searching for cues and triggers and looking for ways to minimize tensions and negative interactions.
Right, right. Are there ways that families can identify these triggers?
Sure. Triggers, just so that we're all on the same page, are reminders about a traumatic event that are quite subtle. Different things trigger different people.
Okay.
Many people will avoid the situations and stimuli that he or she thinks triggered the flashback or their reactions. They may also react with the same level of emotional intensity, similar to that as being in the traumatic event.
Okay.
Triggers are often activated through one or more of the five senses: sight, sound, touch, smell, and taste.
Makes sense.
You can think of triggers in two main ways: triggers outside of your body and triggers inside of your body.
Okay.
So triggers outside of your body might be people, places, events, sights, smells, times or dates like anniversaries or holidays, changes in routines, being treated unfairly or poorly by someone else. For example, a certain fragrance might remind someone of an assault, or yelling or screaming may remind them of a combat situation that was pretty chaotic. Triggers inside your body are feelings, physical feelings, like your heart palpitating or pounding really fast, having your stomach in knots. Emotions like feeling hopeless or guilty or having the sense that you feel trapped.
Wow.
And thoughts like, this is all my fault, or I'm stupid. Like I mentioned, triggers may be hard to identify as they are very subtle. They may include things like unpredictable situations, sensory overload, feeling vulnerable or frustrated, or incidents where you're confronted with a particular situation. This may be an issue of semantics, but what may be more realistic for family members to identify are the antecedents. That is, those things that come immediately before the response, or things that happen during the response, like behaviors, thoughts, or emotions, and then things that happen after. We call these things the ABCs: antecedents, behaviors, and consequences, as they are essential elements to disrupting negative behaviors.
Okay, I think I can remember the ABCs. Okay, good, good. So, de-escalation, is this something that we do differently for adults versus adolescents and children?
I think I would say many of the de-escalation principles or commandments, as you described them, apply. So for example, being prepared, looking for warning signs like pacing or fiddling with objects, yelling, inability to be calmed or soothed. Things like respecting personal space, keeping language simple, managing your own tone and behavior, acknowledging what they want, setting clear limits, offering choices, and discussing what happened in a calm manner after the event are all pretty similar to what you would do in an adult situation. For kids, I think it's important to think about the developmental needs and tasks of adolescents and some of their key values, those things that are important to them, like being independent, respect, having an enormous sense of fairness and righteousness as you move through these steps to ensure that you're operating effectively and in a developmentally appropriate manner. Now, I'm not sure, but I would assume that most VSOs will probably not have direct contact with children and adolescents. So a couple of other things may be helpful when parents find themselves in a high intensity situation with a child or adolescent. First, remember that they too, like adults, can get triggered by an experience as well. So thinking about things that they may have experienced, a fight at school, or violence in the home. So they might be triggered by things that they've experienced like domestic violence or a fight at school. Mm-hmm. Mm-hmm. So in addition to being hormonal and all the things that are happening during the adolescent period, they just may also just lack the appropriate coping skills to respond accordingly. Mm-hmm. Mm-hmm. Some other things to consider are to be mindful of the setting and some of the potential elements that may help either reduce or exacerbate the response. So when possible, think about being able to remove the youth from the situation and or other contextual factors that might kind of play into that. So think about, if they're in school, you might think about maybe they may need to talk to a coach, a friend, a teacher that they find to be supportive to help minimize the negative interactions that could result. Redirection is also another great strategy to use when adolescents, as it increases their opportunities for success.
Now, when I think about de-escalation, I think about it as a situation where someone in the family is already angry. Mm-hmm. The cat's kind of already out of the bag and you're trying to calm them down. There have to be ways to prevent anger from starting in the first place.
Absolutely. Some of those strategies that I just mentioned and that you talked about in your de-escalation module would be important. Things like removing the youth from the situation or modifying the problem context in some way. Redirecting the behavior are great for preventing further escalation, but perhaps the best strategy for preventing a situation is to anticipate the problems beforehand. So doing things like noticing that they're becoming distressed and connecting with them before it goes too far. So when I work with clients, I often teach mindfulness techniques as it raises their awareness of what is going on inside their bodies, their thoughts and feelings, as well as what's happening around them. Being able to identify that someone's level of distress is increasing and their level of control is decreasing is a quick and easy way to mitigate feelings of anger and the impulsivity that often accompanies it.
Is there a specific point in time when anger becomes dangerous?
I think first we have to acknowledge that getting angry is a normal emotional response. Temper tantrums, yelling, lashing out with words, things like "I hate you," which is probably one that most parents have heard, are typical for both children and adults. The question becomes, where does this cross the line
Right.
and become dangerous? And I would say when the angry person has lost control. You think about threats, physical violence, someone gets hurt. They're pretty clear examples of when it becomes dangerous. But as you think about it, there may be some gray spots in there that family members and folks around them will have to really consider. I think that modeling that you can get angry without losing control, basically capitalizing on teachable moments, is a great strategy for family members to employ. Talking to friends and family members about why you're angry is another important tool. Taking a time out, just cool down when faced with something upsetting is also helpful. So doing things like counting to 10, listening to music, deep breathing, those are all great strategies to use when you or other family members are cranked up.
I imagine there are resources out there for families who are dealing with anger in the household.
Absolutely. There are many resources for families experiencing anger issues that range from developmentally appropriate books, games, worksheets, videos, to things like parenting classes, family therapy, individual counseling, interventions such as mindfulness, resiliency building, and many of the cognitive behavioral therapies have been proven to reduce anger, irritability, and most importantly, impulsivity.
So there's a whole toolbox out there of things that someone can do.
Absolutely. There are also plenty of really good resources online that are also quite good. You may need to use terms like emotional regulation and de-escalation to find the best resource to match your situation.
That's what people should type into the search box on the internet.
Absolutely. Google it.
Okay, great. Well, Ernestine, thank you so much for joining us. I appreciate it.
Thank you.